to be confusion with the public. It's extremely important that the public understands that it is safe now and always has been safe to come to any of our hospital sites. The public has never been put at risk. Anyone who needs medical attention at our sites should come for their care. Please let me emphasize again that C. difficile exists in hospitals and in the community everywhere. It is an ongoing challenge across the healthcare sector, as we're seeing from news reports of C. difficile outbreaks at hospitals in Guelph, Hamilton, and Toronto areas in recent days. We called the outbreak at the St. Catharines General Site in conjunction with Niagara Region Public Health on May 28th. Prior to this, as the number of patients with C. difficile increased at the hospital site, we were in regular communication with Niagara Region Public Health. Numerous enhanced precautions were put into place, which included signage in public areas and on patient doors of patients who were in isolation. This is an everyday practice for the Niagara Health System and all other hospitals in the province. Signs are put on the door of any patient in isolation in order to protect visitors and families and those other people coming to the hospital. In Ontario, outbreaks are called based on a number of factors, including the number of new cases in hospital with C. difficile, historical activity level on a unit, control measures that are in place, an overall increased number of patients with C. difficile for 2 consecutive months compared to peer hospitals. It is a very rigorous statistical analysis. The outbreaks at Greater Niagara General Site and Welland Site were declared on June 23rd based on those reasons above. We always work closely with Niagara Region Public Health with respect to our infection prevention and control monitoring and surveillance, and they were involved in regular discussions with us prior to declaring the outbreaks. When we have patients with C. difficile in our hospital sites or any other infectious disease of any sort, precautions are always immediately put into place. These include, as I said, signage in public areas, on patient doors, isolation precautions, enhanced cleaning, dedicated equipment, etc. As soon as the outbreaks were declared, we moved to publicly report C. difficile related deaths that occurred. This is above and beyond the practice of other hospitals. It would be an infringement of our patients' and families' confidentiality and highly unusual for any hospital to report individual deaths directly to the public. Hospitals do report C. difficile rates to the Ministry of Health and publicly monthly. This occurs since the outbreak in 2008 at the Joseph Brant Hospital in